It's difficult for the whole of the country to understand the importance of abiding by the guidelines of the Centers for Disease Control and Prevention to protect themselves and others from COVID-19 when those who make the laws in the country don't abide by the rules. But fate will come after them as well. Representative Tom Rice, RSC, after refusing to wear a mask on the House floor, announced that he and his family have the virus. It was just 2 weeks ago, May 28, that Rice was on the House floor without a face mask. CNN reporter Manu Raju asked the congressman why he wasn't wearing a mask, and he replied that he could maintain at least 6 feet from everyone on the House floor as well as in the halls of the Capitol. He boasted he didn't need to wear a mask. "I do wear it sometimes on the floor," he told the reporter. "I make an effort to stay 6 feet away from folks in accordance with guidelines. And when I'm forced into a situation where I can't do that, like on a plane, I do wear a mask." Among the CDC's recommendations are that everyone wear some type of cloth face covering when they can't be at least 6 feet away from others. On Monday, Rice posted to Facebook that he, his wife, and his son had COVID-19, though he used a more crude name for the virus, referring to it as the Wuhan flu. "I wanted to let you know that all 3 members of our household, Rinca, our son Lucas, and I all have the Wuhan flu. We are all on the mend and doing fine," wrote the Republican representative. COVID-19 is a serious, sometimes deadly, illness. We, however, have fared well. While he noted the novel coronavirus was not bad for me, he also admitted his son had a high fever and really bad cough. Because of the transmission time and that asymptomatic people can be carriers, Rice could have passed the virus to others in Congress in May when he was refusing to wear a mask. "I had a low fever and a mild cough. It was gone by Thursday. I never stopped eating or drinking or working or moving," said Rice. "The only bad thing is I have completely lost sense of taste and smell. Can't taste bacon." He then boasted that he was done with coronavirus, not mentioning, of course, that the people he may have infected when he was refusing to wear a mask may not be done with it. There are other Republican politicians who refuse to wear a mask, notably Donald Trump and Mike Pence. This is despite aides and advisors getting sick. The virus is bipartisan in its attacks, though. Along with Rice, Senator Rand Paul, RKY, and Representatives Joe Cunningham, DSC, Mike Kelly, RPA, Mario Diaz-Balart, RFL, Ben McAdams, DUT, Joe Cunningham, DSC, Neil Dunn, RFL, Nydia Velasquez, D. New York, and Seth Moulton, DMA, have all had the virus. Additionally, Senators Tim Kaine, DVA, and Bob Casey, DPA, were tested to be positive for antibodies after previously experiencing symptoms. In its recommendation for wearing face coverings, the CDC suggests masks or face coverings should be worn when you are out in public and that they should not be used as substitutes for social distancing. They're meant to protect other people if you are sick and not meant to protect you. Children under 2 should not wear face coverings, nor anyone who has trouble breathing or who is unconscious, incapacitated, or otherwise unable to move. When social distancing, avoid contact with anyone who is sick, even in your own home. Keep 6 feet of distance between yourself and others outside of your home, remembering that asymptomatic people can still spread the virus. Additionally, you should wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, a hand sanitizer with at least 60% alcohol can be used. You should avoid touching your face with unwashed hands. If you are around others and do not have a face covering on and cough or sneeze, cover your mouth and nose with a tissue or the inside of your elbow. Do not spit. Immediately wash your hands. Clean and disinfect frequently touched surfaces daily, including doorknobs, light switches, countertops, phones, keyboards, toilets, etc. Use detergent or soap and water to clean them, then use a disinfectant. Be alert for fever, cough, shortness of breath, and other COVID-19 symptoms. Take your temperature if symptoms develop, but don't take it within 30 minutes of exercising or after taking medications that could lower your temperature, such as acetaminophen.